So welcome from Delhi, where it's already searing hot. So with this, the learning objectives in my presentation today are basically the correlation of the clinical profile with the neuroimaging patterns. Most of the audience are pediatricians. They know much more probably about the clinical profile than me, and I'll focus more on the imaging. And I'll specially dwell upon the importance of neurovascular imaging in pediatric intracranial bleeds and just highlight the neurointerventional treatment of some select cases. And then finally, I'll finish with some atypical scenarios that we've had to deal with, especially in our practice in India, with patients coming in from all over the countryside in large tropical countries. Anatomy classified as choroidal, pial, or subpial based upon the location. I won't dwell upon these right now. I'll just go to the imaging. Now, the clinical profile of vascular malformation, they may be antenatally diagnosed as vein of Galen malformation usually are. They may present with bleeds, enlarging head circumference, developmental delay or focal deficits. Sometimes you may see visible external vessels due to veins decompressing, especially through the orbits or in the temporal region, or it may be a completely incidental finding. So based on this, or sometimes they may have systemic features in very high flow rates when the large volumes of shunt happen into the venous system. The children may present with CCF, renal failure, or even liver failure. However, unfortunately, when we counseled the parents of the patient, they were unwilling for the DSA because part of our counseling had to be that the paraplegia and the spinal cord infarct cannot be reversed in spite of whatever has happened. And then there is always a risk we make something worse. Fortunately, we did not get a consent for the DSA and we could not establish a diagnosis in this case of pediatric CNS bleed that I've seen in my practice.